All right, so when I look at the MAR, I see that the patient is Brad Pitt, and the most important thing to notice at the top that I see is that he is allergic to Competency. So when I'm looking at the medication list on the MAR, the medications that fall under scheduled are the insulin is scheduled. Also Lasix, potassium, amoxicillin, dilatazim, and Prilosec. Those are all of the scheduled medications. PRN is going to be his morphine sulfate. And then he has no unscheduled or continuous infusions at the moment. The medications that are due for 9 o'clock are his Lasix and his Prilosec. And then the medications that are due for 10 o'clock in the morning are going to be his potassium, amoxicillin, and his dilatazim. I hope I'm saying that correct. Okay, so number 4, walk me through obtaining the oral medications. So as I'm going to get the oral medications for 9 and 10 o'clock, I will start first with the 9 o'clock ones, state each right, and then I'll say each right. So the first right is going to be the right patient, which is Brad Pitt. His 9 o'clock for his right medication is going to be Lasix and Prilosec. So I'm going to go ahead and grab my Lasix, which is the furosemide on here. So for Lasix, he is going to get a 40 milligram tablet. His dose is 60 milligrams. So if I had 1 tablet being 40, that means that half a tablet would be 20. Sorry, my cat is in the way. Milligram. So that would mean that 1.5 tablets is going to be 60 milligrams, which is what he needs. So he would get 1 tablet, and then I would split the other tablet in half. So there's 1.5 for his Lasix. Sorry, let me move the cat away. His second 9 o'clock medication is going to be the Prilosec. And for the Prilosec, he is getting a 20 milligram tablet, and the dose is 20 milligrams. So that would mean that he needs just 1 of the Prilosec, which is the omeprazole. So there's his 1 tablet for that. So those are his 9 o'clock meds. If I go ahead and do his 10 o'clock meds, I'll put the 10 o'clock in the other cup. He is going to get potassium, and it is an MEQ, a milliequivalent, I believe. And I see that the potassium is 8 MEQ. His dose is 16. So obviously 8 times 2 equals 16. So he will get 2 tablets of the potassium. So here are his 2 tablets. Next is the amoxicillin. It says 250 milligrams, and the dose is also 250 milligrams, so he will just get 1 tablet of amoxicillin. Finally is the dilatazim, and I see that he needs 180 milligrams of the dilatazim, and the dose, or sorry, it's a 180 milligram tablet, and his dose is going to be 360. 180 times 2 equals 360, so he will get 2 tabs of the dilatazim. So there's 10 o'clock meds. Also for the other right, so I said right patient is Brad Pitt, right right medication, I went through all those. The right dose, we just went through all the right doses. The right route, so all of these are going to be by mouth. Yep, all of those are going to be by mouth, and then the right documentation. So after I give him all of his meds, I will go ahead and document all of those into the computer. And obviously, when I go to take him his meds, I will double check all of the 6 rights again when I'm in there and have him state his name and his date of birth, check all that kind of stuff. I believe that is it for number 4. Okay, so the next thing, walk me through administering the insulin. So when I'm going to administer insulin, the first thing that I'm going to check at the very beginning is going to be blood glucose. His sugar levels are the most important because that will help determine the insulin amount. The size needle that I will need, you typically use a 5/8 to a 1/2 inch needle. I have right here a 1564 inch needle. So I am going to go ahead and open up my needle. It says that he needs 6 units. Let me make sure that I'm not missing any questions. The most important thing to remember when administering insulin is that you need to double check the blood glucose, obviously, and then you want to make sure that the food is on the floor before administering any insulin. You also want to make sure that you clean the vial with an alcohol swab before taking it out. You also need to have 2 verifications when you're getting insulin, and make sure that you double verify that you have the right person. And then also the locations that you can give an injection are going to be the backs of your arms, on the back, right above the glutes in the lower back, also on the abdomen or in the leg. So I am going to go ahead and get my insulin ready. Uh-oh, this came up. Well, I just messed up my needle, so that's great. Okay, well, we're gonna pretend that my needle's not messed up. So I'm gonna go ahead and clean my vial. I would stick it in, I would go ahead and get the air in first, and he is needing 6 units, so I'm gonna put it to the 6. I'm gonna push my air in, and then I'm going to pull out to the 6. My needle is broken, so we are making do, but I will show you if this was full of insulin right now, that it would be at the 6, so right below the 5. So there you go for the insulin. Let me make sure that I'm not missing any other questions. Okay, and so if I'm gonna go ahead and inject it into his stomach, so I would stick my needle in and then push my insulin in, and there you have it. So my next thing is, okay, so now my patient is stating that they're in a great deal of pain. What must you ask them before administering pain medication? I would ask them what their pain level is on a pain scale, so maybe out of 10. And then I also, as I bring in their pain medication, I need to ask them their name and their date of birth, and have 2 indicators before you give them anything. When I observe my MAR, I determine that my patient can have morphine. Complete your math. So the needle size that I would use if I was administering morphine would be a 25 to 23 gauge, and I would use a 5/8 to 1/8 needle, and I would put it in their arm. And I would do that because he has 10 milligrams per 1 milliliter. So that would break down, if his dose is 2 milligrams, 10 split by 1 milliliter is going to be 0.1 milliliter times 2 milligrams, and I would get 0.2 milligrams, 0.2 milligrams, milliliters for his dose. So The needle that I have here is actually bigger than what I would use for 0.2. I know that into the arm, it's going to be the smallest amount of fluid possible. What I have here is a 3 milliliter syringe and a 21 gauge. So because of that, I'm gonna have to, and it's a 1-inch needle, and so I'm gonna have to put it in his leg for that one. So I will go ahead and get my needle ready. I'm gonna make sure that I didn't miss any other steps. I told you the needle size, the location. The other locations that I can give an intramuscular injection is going to be in the delts, in your upper leg, or in your glutes. All right, so I'm going to get 0.2 milliliters, 2 of morphine. So I'm gonna go ahead and push my air in first, get out my 2, make sure that there's no air bubbles in there, which is something that I also would have done for the insulin, but I forgot because my needle was broken, so I couldn't see the air bubbles. But this one has air bubbles, and you always wanna get those out before you stick them in. Okay, so here is my 0.2 milliliters. Again, it's pretty hard to see on this bigger needle, so I wish that I had a smaller one for this injection, but we're gonna go into his upper thigh here. Push it in, inject, okay. All right, and that is it for that one. Okay, so finally, administering medication via an NG tube. The head of the bed needs to be at a 30 to a 45 degree angle. Prior to administering medications, you need to make sure that the suction is off on the tube, as well as if you have a continuous feed going, you want to make sure that the continuous feed is off and has been off, and then, or I guess not has been off, but you need to turn off the feed before you give the medication. Next, the types of medications that cannot be crushed are going to be your enteric coated ones. If you have anything on your MAR, you need to make sure that you are reaching out to the physician and getting, or the doctor, or the pharmacy, and getting a different version of it. When you are giving medications through an NG tube that can be diluted, you want to go ahead and dilute them into 30 milliliters of water. You also want to flush with 30 milliliters of water first. Following that, you want to give your first medication, followed by 15 milliliters of water, followed by the next medication, followed by 15 milliliters of water, followed by 15, etc., until you get to the end. Finally, you want to finish off with 30 milliliters of water to flush it, and then you can start your feeds back on as soon as you finish. Make sure that I didn't miss any other questions. And that is it.